Hello students, welcome to Orthopedics. I'm sure that most of you have had one art posting already in orthopedics and you already know a bit about orthopedics. Said that not everyone knows about orthopedics, or some of you would not have had posting in orthopedics. So let me introduce you to one of the very important, extremely interesting subject of the final years, that is orthopedics. Today, once we finish our entire interaction of 15 to 20 minutes, we are going to actually learn and understand that why we need to learn orthopedics. How do you prepare for the orthopedics in the final MBBS examination and for the NEET exam? And should you be taking up orthopedics as a specialty or not? It means, what does it offer as a subject to you? What is the importance of this subject as far as your clinical experience is concerned, your exams are concerned, your routine practice is concerned after the MBBS, and what if you plan to take up this subject as a specialty? So what is something different about this subject as compared to rest of the clinical subjects? So if you think about orthopedics, it is one of the medical surgical field which focuses upon the health and diseases of the neuromusculoskeletal system. Normally, you may be thinking that orthopedics is about the musculoskeletal, that is bones and joints. But no, not necessarily only the bone and joint. We also cover the neurological diseases. We also cover about the muscle, tendon, and various other soft tissues like ligaments, capsule, etc. So it's a very vast field. You can imagine neurological components, the muscular components, tendinous components, capsular components, bones and joints of the entire body. So it is a field which has got vast scope as far as the subject is concerned, and we deal with lots and lots about the physiological and the pathological conditions. Now, when we talk about the history of orthopedics, when I started reading orthopedics, I was introduced to one gentleman named Nicholas Andre, who actually coined this term orthopedics after publishing a book in 1741 where he corrected the pediatric deformities. So I thought that probably orthopedics has got origin for only in the last 200 to 300 years. But then one day, just few years back, I sat and thought, mankind has been there for millennia. How is it possible that this subject has existed only for 200 to 300 years? It means this subject must have existed for far more longer. Probably we only do not know. So the question is how old this subject is. Who has described this subject first, or whatever is written in the text? So do you know who is? He is Maharshi Sushruta, who has described a lot about the surgical diseases in Shushrut Samhita in 1600 BC, that before even the Christ was born. So the orthopedics dates as that back in written. I am sure that even before orthopedics existed, but we do not have much of documentation about it, because if mankind has existed, I am sure that there were physicians and healers who knew how to manage the diseases. But the latest documentation about the orthopedic diseases, what we have from the 1600 BC in the Shushrut Samhita. To your surprise, actually Shushrut has described one of the very early surgical procedures like cataract surgery, various plastic surgical procedures. And he has described orthopedics in Shushrut Samhita as Bhagna Chikitsa. Not only that, the various terms like fracture, that is Kanda Bhagna, dislocation, Sandhi Moksha. See, Bhagna means breakage. Sandhi is a joint. Moksha means moving away, and other orthopedic diseases. So he has already described a lot about, said that there was not much description as far as the surgical management is concerned. Most of the diseases were managed conservatively, including the fractures and dislocations. To his credit, more than 125 instruments are there in the literature, which he himself has described in the Shushrut Samhita. So the history of orthopedics is quite old. But what we are going to talk about today is a bit about the modern orthopedics, whose history dates probably a bit as old as 400 BC, when Hippocrates does give some amount of account. But if you want to know where lump sum the modern orthopedics started, was 1741, when Nicholas Andre described the correction of the pediatric deformities in a book, and where he said ortho means straight, pedia means child, and that's where this orthopedics name came up. Now this Nicholas Henry orthopedia is an MCQ also for you. They often ask who was Nicholas Henry, what did he describe? But from there, the orthopedics kept on seeing leaps and bounds. In last 200 years, orthopedics has seen immense advancement, especially in last 30 to 40 years. So right from the John Hunter to 1728 to 1793, Ashley Cooper, the orthopedics was advancing bit by bit. But there were two major problems with orthopedics. What was impeding the growth of orthopedics was the sepsis and lack of anesthesia. You know that by nature, bone is a relatively avascular structure. And something what is avascular is very prone for infections. The wounds would not heal. And that was holding on the advancement of the orthopedics, because 100 to 200 years back, whenever anybody got operated, any kind of surgical intervention was done on him, it often led to infection. And second was that doing a procedure, orthopedic procedure on a patient without anesthesia was very, very painful. And that was holding on the advancement. Said that the Crawford Long, followed by W.G. Morton from Boston, Massachusetts, described the usage of ether first time for the dental patients. And that brought the first ever modern anesthesia to the world. Louis Pasteur came up and described, and he said that these are the bacteria which causes the infection, followed by Joseph Lister, who brought out the first so-called modern surgical principles and medical principles to curb the infection by introducing the aseptic measures. And once the Röntgen described the usage of X-ray, from there onwards, the orthopedics kept on advancing bit by bit. The 18th and 19th century saw a good advancement, but the orthopedics has really advanced in last, you can say, 4 decades. From 60s, 70s onwards, that is, you can say last 5 decades, orthopedics has really advanced in the terms of newer and modern fixation techniques, fantastic materials which are very long, durable, very robust. Various other orthoses and processes have come up in the field. The advent of microvascular surgery and minimally invasive surgery has made this field extremely sophisticated, because for a lot of you, you think that orthopedics is a very crude branch. A lot of you who have gone to the departments, or sometimes you have gone to the theaters, you most of the time end up seeing those fractures and nailing, plating, hammering, malleting, screwing the bone, and you feel it's a very crude branch, or you can say, jokingly we can say it's a bit of more modified or a refined carpentry. But that probably is not true. Yes, probably that was true about 50 years back, but in last 50 years the orthopedics has advanced a lot. A lot of instrumentation has come up, which has made orthopedics a very sophisticated branch. Look at arthroscopy. What is brute about arthroscopy? Look at the spine surgeries, extremely delicate surgeries. A millimeter here and there, and you may end up damaging the spinal cord or the nerve roots. Pediatric orthopedics, there you are dealing with extremely gentle and thin tendons and bones and the arteries and veins. Pediatric orthopedics, where you deal with the extremely gentle bones and joints, cartilage, thin tendons and nerves of the pediatric foot or any other part of the body. If you look at the microvascular surgery, the upper limb surgery, the brachial plexus surgery, the hand surgery, what is brute about it? There's nothing brute about it. Joint replacement surgery, even though it looks a bit more rough, but if you look at the instrumentation which are today used in the joint replacement surgery, they make the life of a surgeon extremely easy, and they are no more a very rough branches. So what I'm trying to say is that there is a lot of advancement has happened in the last 50 years in orthopedics, making it a very fine branch with lots and lots of options. There are many of the Indian orthopedic surgeons who have contributed immensely to the orthopedics, such as B. Mukhopadhyay, Professor Bakshi and Saha, and so on and so forth. I cannot enumerate those names because they are endless names. So from the history of orthopedics and what orthopedics at the moment grossly is, I'll move on to something which you are waiting for to understand, that how or you must be, devoting your time, or how you must be reading orthopedics in the final year. Now, the problem with the orthopedics is it is a minion among the big four brothers. So you have got this surgery, medicine, OBG and pediatrics in final year. Though these classes, they start almost as early as from 3rd and 4th semester, but the concentration of these 4 subjects happens in the 8th and 9th semester. And you are really bogged down with these heavyweight 4 subjects. So orthopedics find itself quite a lot ignored. And there are some centers, not all, but there are some centers where orthopedics somehow is not given much importance because of various reasons. So at the end, what we find that a lot of students, once they are finishing their final year, they are not very apt at orthopedics. And once a subject is ignored to some kind of a preconceived notion, though orthopedics is quite brutal, okay, it's only for men, okay, it doesn't need much of focus, somehow the subjects get ignored. But we fail to understand one thing about orthopedics, that surgery, medicine, pediatrics, not really pediatrics, but you see surgery and medicine are mostly the branches where there is going to be some kind of a disease. Having said that, in orthopedics, it is a branch of aging, where if the person gets aged, there are going to be some problems which are, you can say, not really a disease, but they are part of the aging process. Let us say spondylitis, let us say osteoarthritis of the knee, or some kind of a tendinopathy. They are going to eventually come to the physician or the surgeons or the orthopedic surgeons. So you need to have some kind of an idea about those diseases. Yes, if you are a physician, you are, let's say, a surgeon, you may not be treating those problems, but at least you need to have an idea that, okay, this patient is having tennis elbow, this patient is having probably cervical spondylitis or lumbar spondylitis, and you need to refer it to your orthopedic colleagues. Hence, the idea about this subject is extremely important. So the question comes, how do we study this subject? Now, my favorite way of studying this subject is, or when I advocate to my students that how you should be studying this subject is, the first and foremost prerequisite to learn and enjoy orthopedics is have the basic idea of the anatomy. If you do not know anatomy, then it becomes quite difficult to understand, because 90% of the problems, signs, symptoms, etiology, management revolves quite a lot around the anatomy. If you know that what structure is here, what kind of bone is it, what kind of joint it is, which nerve winds around this particular bone, it is very easy to understand the signs, symptoms. Hence, the orientation to relevant anatomy is important. And you will see in my all forthcoming session that I have introduced as much possible as relevant anatomy in almost every session to make the subject very, very interesting. Otherwise, if I straight away, let's say, move on to the fracture clavicle or fracture proximal humerus or fractures of the elbow, or let's say hip dislocation, without introducing you to some relevant anatomy, that okay, what kind of nerves are crossing the shoulder joint, what kind of tendon is attached onto the tip of the greater tuberosity, which nerve is at the back of the hip joint or the back of the knee joint, it becomes very difficult for you to understand the subject. Hence, the first principle I would say whenever you want to read up about the orthopedics is always try to read the relevant anatomy. You need not to go back to the anatomy books because they describe the anatomy quite in detail. That was fantastic in those years, but not now. So you need to read only the orthopedics textbooks, which in general will describe some amount of anatomy relevant for that topic. Don't ignore that. That is the first principle. The second thing is, routinely in most of the medical colleges, the first posting starts somewhere around 6th and 7th semester. And I am not talking at the moment about the CBME batches, which will come probably in 2022-23 onwards when they'll come to final year. At the moment, the older batches are still following the semester pattern and the old traditional pattern of orthopedics teaching. So your first posting starts somewhere in 7th semester. Now, once you are in 7th semester, you're already bogged down regarding the exam of the ENT, Ophthalm and SPM. And I understand completely that it's very difficult for you to give focus to orthopedics if it is taught in clinics or if there are any kind of theory lectures happening. So in such situations, what you should do? Focus only upon two things. One, if you can, in 7th semester, understand one, that how a basic history is taken in orthopedics and how the examination of orthopedic patient is slightly different from the medicine patient or a surgery patient. That is point number 1. And if you can finish 3 joint examination in a reasonable concepts, that is knee, shoulder and spine. If you can manage these 3 joint basic examination with some idea of the common diseases which are taught in the 7th semester, I think that should suffice. In 7th semester, you must try to focus upon the ENT, Ophthalm and SPM. Once that is done, now you are in 8th semester, fresh, ready to go with the 5 subjects, 4 big brothers, 1 minion. How you manage orthopedics? Most of your time will be devoted to surgery, medicine, pediatrics and OBG. So how you take out the time? The basic principle of final year is, I am telling you today, the basic principle of final year is do not miss classes if they are conducted regularly. Always go to the classes. Theory, okay, if once in a while you can miss due to some or other personal reasons, but practical classes never miss. When you go to the theory classes, always, if possible, take the class notes. Never demean or undermine the power of the class notes, which I realized when I was even an MS student doing my MS Orthopedics in KGMC Lucknow. I realized that my undergraduate notes still had lots and lots of relevant features which were applicable to my postgraduate teaching. Okay, so don't undermine the power of your undergraduate notes. The teacher who comes and teaches you in the class and gives you some kind of a notes, or you are just noting down what is he jotting on the blackboard. So take your class notes always seriously. If possible, your own made notes. Then you can go back to the room and you can read any standard textbook of your choice. Depends upon what kind of textbook you like, because some textbooks give the explanation in too much of detail, some remain a bit more crisp and concise and precise. So it depends upon what your choice. I would not advocate anything in special. What you love, what you can understand, which book you fall in love, read that textbook. But try to make one concise, compiled source of information for final year. Because on the day of exam, whether it is a semester exam or it is your final sessional exam, you can't be going back to notes and then A book and B book or C book. You can have your own small notes. You can have your attached pages in that to give you the final day of information. When you read theory, it is also important that pick up the important chapters, pick up the important areas which you are seeing them more and more frequently in clinics. Or if your teacher says that this is very important clinically, this we see very often in casualty, this we have been seeing, or you have seen that particular case in the clinic, trust me, those are the theory questions which are likely to be asked in your exam. 1 day a week or 2 days in a week, it is important that you give some time, at least an hour and a half, to orthopedics. Orthopedics in general is relatively easier subject if you try understanding. Compared to, let's say, surgery and medicine, which is very vast, orthopedics, even if you give a little devoted time, it's easier to grasp this subject, especially the traumatology. Because traumatology, the clinical features, investigation, and partly management follows some kind of a algorithm, which you will see in my forthcoming sessions. They are far more easier. I'll give you an example. All fractures, whether it is the, especially the appendicular fractures, there is going to be pain, swelling, possibly a deformity and inability to use the limb. When you see the signs, there will be bony tenderness, there may be crepitus, abnormal mobility and inability to use the limb. Neurovascular examination is mandatory in orthopedics, especially in traumatology. So you see these 4 plus 1 symptoms remain fairly constant in all traumatology topics. Do you understand? So hence orthopedics becomes quite relatively easier to follow as compared to the rest of the 4 subjects, where it is not easy. Each disease can come up with a different signs and symptoms. Yes, when we move on to the cold orthopedics, it is slightly different. Each disease can be a bit different. Said that, the traumatology is far simpler. Now, moving from the theory topics, go to the clinics. How do you read about these and how do you understand these practical cases? The dictum for MBBS and for that matter final year is, when you will start watching these sessions online or on your any platform, you will probably in 8th semester, I would request all of you, do not miss clinic. If you are in clinic, may whatever comes, something or other you will watch, you will see, your teacher will explain to you, you will see a sign, you will see a symptom, you will see a deformity. He will tell you the practical management then and there. Let us say you saw a patient who's an old man, about 50, 60, 65, he came walking with a lot of, some kind of a limp. He says, I have got bilateral knee pain. It hurts when I walk, when I try to squat, when I sit cross-legged, or when I stand for a long time. When you look at his leg, the legs are bowed like this. The joint lines are tender. You keep the hand over that, it gets you the feeling of a crepitus. The range of motion is limited. This is typical osteoarthritis of the knee. 2, 3, 4 cases you see, you will never forget all your life. Even if you take up tomorrow general surgery, pediatrics, or let's say the gynecology, you will still know, oh, this could be osteoarthritis. That is the beauty and the power of the clinical cases. Once you have seen there, 50% of the job is over, because with some kind of a recollection and a memory, you'll be able to write that question in very easily in exam. Management is taught then and there. He will tell you, okay, send the patient to physiotherapy. You ask the patient to do the quadriceps exercises, give the analgesic, some kind of a drugs which are joint protective in nature, injections like steroid or hyaluronic acid, and if the patient doesn't respond to any sort of such treatment, maybe an arthroscopy, a joint replacement. So the clinical interactions give you so much of information in such a short time with the patient right in front of you. It cannot be compared when you read the same thing in theory. You try reading the same thing in theory, you will not be able to grasp that. I'm telling you with my experience for 2.5 decades spent in medicine, what you grasp in clinics, it is extremely difficult to grasp in the sitting in a room and imagining something. I have lost quite a lot of marks in certain subjects when a particular case was asked, case was given in the practical exam, and I recollected, oh, this was the clinic which I missed. It happened to me in 2 of my subjects, one case each. I had just missed because of some laziness, I did not go. So I would always say that never miss the clinics, because there you will always get a lot of information. Once you have a broader idea of that particular case, you can always go back in the evening and supplement that and close that. There are certain books, my own book, which discusses about the clinical approach to a case, where we have taken up, let's say, the malunited distal radius fracture, osteoarthritis of knee, rheumatoid arthritis, various deformities, non-unions, malunions, like how they will present clinically. How are you going to approach them clinically rather than in theory, where you start with some general features, etiology, pathology, clinical features and management. So those certain books also really help you. Now, the 4th point, you might be thinking, what is this? Should I be preparing for actually the final year exam, or should I be actually preparing the NEET? Now, I'll tell you a small story. When I joined MBBS, in few months' time, I told my father, who himself is a general surgeon, that how should I prepare for PG entrance, because eventually after 5.5 years, I have to give my PG entrance exam. And he gave me few mantras. He said, number 1, do not miss your classes and clinics. He said, you have no business to be not there in the classes and clinics when you are there in the campus. He said 8 to 5 you be there. After that, if you have already seriously and sincerely studied, you would require very less effort after that. That is point number 1. Point number 2 is, if you read your subjects, medicine is such a subject that if you read it carefully, intensely, 4.5 years, NEET, it's extremely difficult for me, even who will be setting up a lot of questionnaire for your exams, to set up something which is very rare and odd. If you see the pattern of questions which have been asked in various exams, whether it is a NEET or some specific exams like AIMS or PGI Chandigarh or something else, the questions, 80% to 90% questions are on the common disorders. 50% are quite straightforward, Another 20 to 30% are a bit difficult on the same common disorder, and 10% are rare. So you have to understand that during your 4.5 years, and especially if you're talking about, let's say, a subject specific orthopedics, you would be spending 1 full year. That's the time you study that subject so seriously that when you start your internship, and maybe unfortunately, if you have to drop an year, you don't have to really start digging up your basics. If you're not good at basics, then you'll be spending a lot of time in reaching that 50% to 80% level rather than actually finishing off and just fine tuning your subjects. So one approach is, when you're reading, let us say, traumatology, there are many MCQ books which are available today which go chapter by chapter. So it will cover, let's say, endocrinology, or let's say the metabolic disorder, degenerative disorders of the spine, knee, pediatric disorders, traumatology. Finish it off then and there. See what has been asked. Then you will say, oh, my teacher in morning at class actually told that this is often asked in NEET, and I didn't actually realize. See, it has been asked three, 4 times. So one of the best ways is, have a book right in the beginning when you start your semester, and as you are doing those subjects, try just flipping through those MCQs. Not necessarily that you can sit and you have to sit and read and solve each and every MCQ. But what you can do is, you can actually flip through those, and then you realize, oh, this point I missed. Oh, this point I didn't take it very seriously. In fact, it is asked in MCQ. So that consolidates your knowledge. And trust me, once you read, once somewhere it gets, jammed in your memory somewhere, you will be able to recollect it far more easier way when you start your internship. Otherwise, internship, it is a completely new game. Till now, you were reading only theory and some practicals, and now you are introduced to these MCQs. Okay, so don't get scared. In all subjects, you can do the same thing. Pediatrics, surgery, just open and flip through pages and see what they have asked. And this is what I also did. Though in our times, we had only one odd book, not like today when you've got apps and books and online and offline and plethora of resources. In our times, we have only one book, but I did go through some MCQs when we were in final year. But I still feel that if you are excellent in your theory and practicals, you do not miss your classes, you go to the clinic seriously, trust me, your 60% to 70% of the NEET syllabus is already done. I have asked all my graduates who keep on cracking NEET every year, and I asked them, tell me, when you appeared for your NEET exam, when you came out, what was your idea? Do you think that your 9 months to 10 months of internship reading was really important? Or was it 4.5 years of excellent teaching what you gained in Manipal by your various teachers and the lecturers and in clinics was important? They said, sir, we could recollect 70%, that 70% to 80% of information was already given when we were reading these subjects. It's only 15 to 20 or maybe you can say 30% of the syllabus we had to retune and refine during the internship or maybe during the drop year. That is the power of constant reading for 4.5 years. Coming to the exam proper, reading for, let's say when you're reading during your 8th semester. So 2/3 of your semester, you should focus upon detailed reading, making good notes, gaining the concepts, further reading. But then last 1/3 of the semester, or let's say last 1 month is left for your theory exam, practical exam, whether it is a sessional or your university exam, you must then and there focus on a very focused reading for the exams. That time you should not be worried too much about the MCQ, reading a very rare disorder, reading something which is very complicated, which you did not understand. That's the time you should focus totally for exams. Now, I personally is not a very exam kind of a man. Like I always felt they are part and parcel of life. In some exam you will do well, some exam you will not do well, it's okay. But then doing well in exam, getting a reasonable mark, it's good for your moral boost. It doesn't mean that if you got some bad marks in one of the sessionals or one of the practicals, it means that you are a bad student. No, not necessarily. No, not at all. But if you have worked hard for full semester, it is important that you should get a reasonable marks. And then there is a focused approach to get those marks. Because remember, Knowing the subject is one thing, recollecting, writing in exam is another thing. Writing in a specific format, the way it has been asked, is also one important thing. So what should be the source of your knowledge? As I told you, try to read from the class notes. Make one class note, and in that you keep on collecting the information from various sources. On the day of exam or a week before exam, don't follow too many sources unless and until you got a doubt. Opening a new textbook, buying a new textbook, went to some bookmark, and you saw some, it's a new textbook which has come. It's not a great idea during the exam. You should have done it right in the beginning of the semester. Okay, somebody gives you a classified note, some important notes which has got some important question, it's okay. But new textbook, no. Class note should be your main source of information, which is filled with the rest of information in the last 2.5 or 4 months. Revision of question papers, especially what has been asked in last, let's say 10 years or 5 years, which core topics they have asked more, which questions have been asked more. Let us say, I'll give an example, complications of fracture. So what have they asked actually in complications of fracture? So you will find a pattern: define fracture, enumerate acute local complications of fracture, describe any one. And you saw this particular question in some permutation combination has been asked many times, but they have always done one acute or one chronic to be described in detail. So what you do, you read one chronic or one acute which you love most and you can describe best. Go with that. So what happens? Suddenly you see the same question, you are well prepared mentally, and then you can write it very well. During the last 1 week of exam, I've often seen the students, I myself have done these mistakes sometime. What we do, we most of the time read and revise. And what we don't do is recollect. During the exam time, you should try to recollect the information. So let us say you see a topic of fat embolism. So you're trying to see, okay, if a fat embolism short note is asked or a long question is asked, what all they'll ask? They'll ask the definition, etiology, pathology, clinical feature, investigation, management. So do I know the definition? Yeah. Okay, this is this complication acute where there is a micro flat globules are into the circulation, clogging the pulmonary and the cerebral circulation. Okay, why does it happen? Because of long bone fractures. Okay, what is the pathology? Oh, it clogs the smaller capillaries of the lung and the brain. Okay, what are the clinical features? Like that. And then you go back to the textbook and say, oh, I could recollect actually more than 80%. Done. That is what misses in exam. You only flip the pages, you keep on flipping, you read, sometimes you revise, but you have not recollected. So you think that you know, but in fact, when the same question is given in front of you in the exam, you will not be able to write the same because your mind is not ready in the same format. NEET questions. If your college has got some kind of a MCQ pattern, which is many of the colleges have now adopted, they have got, let's say, 20% of the questions asked as an MCQ, you can read those NEET questions at that time also. Coming to the practical, comparing our subject with the surgery, medicine, OBG and pediatrics, we are again minions. Most of the time the orthopedic practicals in exams are relatively simpler, though there is more stress on the ortho side because you haven't read. So that's what I said, try to follow the common cases for 8th and 9th semester and see, and you can ask your consultants, teachers, said that what is commonly asked in exam. So they'll say, okay, you must know the non-union, malunion, chronic osteomyelitis, osteoarthritis of knee, some shoulder pain, maybe one or tumor like exostosis or osteosarcoma, some back pain, whatever. In general, the institution slightly follow a different pattern. If you're in an A institution, the teacher may say, okay, we also once in a while keep a hip case. Some institution like, let's say, Manipal, because it is a center of excellence for the Perthes disease, or let's say the CTV, in general, we also keep a CTV. Whereas CTV may not be kept in some other medical college. So that is also one smart way to find out with your examiners for 8th and 9th semester, so that what is commonly asked, so that you are well prepared about those cases. Then there is usually one table where there will be instruments, implants, x-rays, prosthesis and orthosis, which is usually quite simple because in orthopedics we believe that it is a super specialty subject and we don't go into the depth of each of these. So we'll always try to show you very simple x-rays like osteoarthritis knee, osteomyelitis, non-union, let's say exostosis, osteosarcoma, which any average undergraduate can actually recognize and explain about it. So one is the semester training and one is the exam training. So in exam, when you go, you should be smart enough to understand that these are the common things which are asked. Let us say you fail to recognize one or something which is a rare implant which is kept on the table, but then examiner won't mind. He will again show you something, let's say Austin-Moore processes. Now if you don't recognize Austin-Moore processes, or let's say the K-nail, then or a dynamic hip screw, which is usually asked in exam, then it is not a good thing. So always try in exam, whether it is theory, whether it is practical, try to read, revise and recollect always the common things which are commonly asked or has been commonly asked in the past. You can check through the various question paper. You can ask your seniors that what kind of cases do they keep, what implant they usually ask, which x-ray was asked. So they'll say, okay, these are the x-rays. So then once you have the compendium of the information, you can focused preparation for the exams. Now, as I keep telling, almost everyone passes MBBS in a reasonable time. So when it comes to the preparation of orthopedics with respect to the NEET, as I told you that your preparation ideally should start right from the 8th semester. And for that matter, for all subjects. Don't keep the things pending for the internship and later on. Because during the 8th semester and 9th semester, or even before that, especially in surgery medicine, you can always flip through those NEET MCQs or various MCQs and see what is the pattern, what kind of questions they ask and on what subject or what topic they focus more. So let us say you have got an idea that these people focus more on traumatology. In traumatology, they mostly focus around the femur, pelvis, spine and the clavicle. I mean, just giving an example. So those things you should have read it well in advance. Then you take, each by each. There are people who go MCQ by MCQ, but I would say that always cover the region by region. So you start with the traumatology, let's say upper limb, then lower limb, spine and pelvis, then go through the MCQs of the various disorder, let's say degenerative disorder, metabolic disorder, pediatric disorder, and see that you cover each portion clearly. Quality of preparation in the NEET is more important as compared to the quantity. Oh, I solved today 500 MCQ, but you didn't understand the concept of more than 10. What's the point? So even if you end up solving 100 MCQs a day, you should be able to grasp the concept around that question. Because the same question will not be repeated. They will ask a question in a different fashion. And that is possible to solve only when you got a good concept. As I've written, simultaneous preparation of the NEET during final year when you're reading the subject. Again, prepare the subject, especially when you are posted in the internship. So let us say you got a month-long posting in the orthopedics. So what you need to do is, when you're already posted, you're coming in morning and going in the evening, that's the time you should see the cases, sit with a consultant. The best way is sit with a consultant when he's seeing a case. So you'll see, okay, this osteoarthritis knee, spondylitis, frozen shoulder, rotator cuff tear, part spine, CTV, and by the time you have sat with him for, let's say, 4 OPD days or 5 OPD days or whatever, you would have finished at least 50% of that part of the MCQ. Since you are already posted, why not to use that time? If you are in the theater, assisting a case, watching a case, ask, sir, what is this? Oh, this is femur. Sir, what is being done? Femur nailing. Sir, femur nailing only is done in during or? No. In adults, usually we do the femur nailing. That is an MCQ for you. That today in modern orthopedics, the treatment of choice for femur fracture mid-shaft in adults is femur interlocking nailing. 30 years back, Thomas knee splint. Now the orthopedics have slightly changed. Again, check the pattern of questions and topics which have been asked in last 10 years. Okay. Now once you have finished the understanding the subject, prepared for the NEET, you got through the NEET, should you be taking up it as a specialty? Now here I'll stop and I'll put a word of caution. Why orthopedics? You should take up the specialty only if you are interested in. Do not take up any specialty, whether it is orthopedics or surgery or medicine, OBG, pediatrics or ENT, ophthalmo or whichever paramedical. I'm not going into that, but do not take up a subject if you are not interested. Often, some students, they take up the branch because of some kind of a fashion and a trend. Oh, orthopedics is very nice. Let me take up orthopedics. A word of caution. All of us strive to make some money. It's okay. It's good to make money. But monetary rationale of picking up the branch is the first point of your failure. Don't take up a branch because of monetary reason. Money follows. Fair enough. But monetary reasons of picking a branch or for the trend, oh, my senior says this is a fantastic branch, now you take up. But have you got the potential? Are you really interested in that? During the internship, if you have got some inclination for a subject or you're developing the inclination, always try to understand that what is life beyond what you are seeing now, what is actually there on the other side. Go and talk to the residents, talk to consultants. You will get an idea that what this branch is about. The third point is, when you pick up a branch, let us say you pick up a branch in 2024, you have to extrapolate the possibilities of that branch or yourself in 2034. Because remember, in most of the clinical specialties, whether they are medical branches, whether they are surgical branches, the real scope or you being a reasonable level consultant, that time takes about 10 to 15 years, not before that. So if you have taken a branch in 2024, your real potential will actually start in 2034 onwards. So you have to extrapolate that what will happen when I'll be in 2034, what this branch offers. Is there any other branch which is actually much high in demand, but so-called not so glamorous? So should I be taking that one? I'll give an example. Now recently, Medical Council of India and now NMC is making a proposal that emergency medicine will be mandatory in almost all medical colleges by I think 2025, 24 or 25. I'm not really sure about the date, but this is it. And there's a huge gap. We don't have the physicians who are qualified and experts in emergency medicine or critical care. You would have seen in this pandemic that critical care specialists who are specialists in, let's say, managing the respiratory diseases, the ventilator and so on and so forth are really, really required, and we don't have that kind of specialist at the moment in the country in the appropriate numbers. So picking up a branch which you can presume that, okay, this is what country would require in another 5 to 10 years, and there are lesser people taking up this branch, that branch has got a better scope rather than picking something on a fashion and last but not the least on the monetary basis. Coming to this now, if you are interested in orthopedics, do take up because it's an excellent branch. One, you have to be passionate about orthopedics because it's a branch which is very demanding, especially in terms of the mental strength. If you feel that this is a branch where there is a crude force is required, lot of pulling and pushing is required, gone are the days. Today we have got fantastic hardwares, the tables, the power devices which can actually reduce the amount of force what you require. And the force is required only in one part, that is in traumatology. In that also only in certain lower limb fractures, let's say fractures around the femur. If you talk about the tibia fractures, foot fractures, upper limb fractures, there's hardly any force required. So it is a branch not of the force, but about the refined biomechanics. It is not the brute force which reduces a fracture. It is the correct technique applied in the right principle and right manner helps in reducing the fracture. So the concept of being a very brute, you need to be have some six packs or good biceps and triceps will help reducing the fracture. No, not necessarily. I don't have any of those, but I still manage my things very reasonably. So remember, one, you need to be passionate about orthopedics because it really, really tests your mental strength. Being a busy subject, busy specialty, road traffic accidents, number of patients, so you'll always remain very busy being a resident. So if you have just picked up thinking that, oh, it's going to be very relaxed life, it's not going to be the scenario. Lot of hard work in the wards, in the trauma center and in the OPDs is required. A lot of time is spent in hospital. So here you need to be passionate about that. But once the residency is finished, once you have finished 3 or 4 years of further training as a registrar, senior resident, or even as a junior assistant professor, the life starts becoming a little bit more relaxed. So initial years could be a bit tough for you. Another important thing is you must understand that it is not a end specialty. In fact, the branches which are appearing to you now as an end specialty will no more be an end specialty in 2034 or let's say 2040. And you should always extrapolate your career 15 years later, because the way you see your career today will not be the same in 15 years down the line. I'll give an example. Let's say general surgery. By 90s, 70s up to 1970s, mid 70s or very early 80s, general surgery per se was an end specialty. And orthopedics was hardly anywhere, and orthopedics was also a end specialty. But by 2000, see, just 20 years. So if you had finished your MS general surgery in 1980, by 2000 there were 6 to 7 subspecialties already fully flourished in general surgery. So the people who thought in 80s that general surgery is an end specialty was no more later. So you have to always extrapolate. If you think, okay, pediatrics is an end specialty, will not be the same in 20 years down the line from now. Take my words. So always think a bit about future. That's how you take up your specialty. Orthopedics per se is a very vast subject. What is being read as a graduate, it is I say, shadow of the tip of the iceberg. There's nothing which you have seen. There's a lot more in orthopedics. Generally, when it comes to the training, so you have to do the basic training in orthopedics as either MS candidate or in the DNB. Once you finish that, then you have to finish your 1 or 2 years of registrarship or so-called senior residency in various institutions, and that's the time you start getting an idea that what kind of subspecialty I must be pursuing my further career. There are many fellowships in subspecialty, both inland and there are many subspecialties whose fellowships are available in India and abroad. Look at the subspecialties which are at the moment, and I'm sure 20 years down the line there'll be at least 5 more. So we have at the moment subspecialties which are already getting a subspecialty fellowship certificates, and I'm sure by the time you are planning you are finishing your, let's say, orthopedics residency, SRship, half of them would already have an MCH and FNB orthopedics. Some of them already have got an FNB orthopedics, that is fellow in national board. Traumatology, sports medicine, joint replacement, spine, pediatric orthopedics, hand and microvascular, orthopedic oncology, foot and ankle. In India, at the moment, there are several institutions which follow or which offer the fellowships in traumatology, sports medicine, sports and arthroscopy, joint replacement, spine, pediatric orthopedics. Recently, I think the NMC and erstwhile MCI has already permitted the MCH in pediatric orthopedics. So this is 2020. You extrapolate your career to 2035. By that time, almost every branch will have a standardized fellowship programs or a standardized super specialty programs. I don't know whether you can figure out this slide or not. What does it mean? So being a teacher, I'm often asked, sometimes the girls ask, sir, what is the scope of orthopedics when it comes to the women? And I tell them, orthopedics at the moment is experiencing the same change what probably the surgical sides, especially the general surgery, was facing in 80s and 90s. So if you see the 80s, 70s and 60s and 80s, the general surgery and largely most of the surgical side except ophthalm was mostly picked up by the men. But in last 15 to 20 years, a lot of girls pick up these surgical sides also and doing excellent work. Same thing is happening to orthopedics in last a decade. Bit by bit, girls are taking up. And the reason why they don't take up orthopedics is it is always considered to be a branch of brute force, which I explained to you that is no more the case. And if some kind of a brute force is required or some kind of an extra force is required, that is only true for the probably the lower limb traumatology, and that too around the hip and the pelvis, hip and the femur. Rest of the branch is not about the force, it is about the right principles and biomechanical methodology which you use to reduce a fracture or to manage a condition. There are many excellent orthopedic surgeons already who exist in our country and offering excellent services to the patient. But the things take a lot of time to change. And I also say that if the women can become the fighter pilots, if they are already into the elite forces of the security services like the Army, Navy and the Air Force, then I think orthopedics is minion when you compare them with the amount of physical strength and stress which a army man has to go through. So we have got nothing such, we have no such requirement of brute force what an army man has to go through. So it is a branch which can be picked up. Yes, initial first two years are a bit tough, but then after the residency, once you finish your researchship, you can always pick up one of the subspecialties, which is actually almost like an elective branch. It is far more relaxed than gynecology and especially the obstetrics, because obstetrics is a very unpredictable branch, whereas orthopedics, if somebody has got an ACL tear, it will be torn even today, tomorrow and even after 6 months. There is nothing emergency about it. There are 4 or 5 emergencies which can be managed with a lot of ease. Rest of the orthopedics, even traumatology, remains a non-emergency branch. Colles fracture, what is so emergency about it? Both boniform fracture, unless there is a compartment syndrome, there is no emergency. Humerus fracture, there is no emergency. Patella fracture, what's the emergency in that? And rest of the cold diseases are completely different. So it is a specialty which can be picked up by the women, but you have to be very sure that you are passionate about it and you are not just taking for the sake of it. So with this, I would end this session and I would say this: let's start the journey of orthopedics and enjoy and fall in love with orthopedics, because I am telling you, this is one of the most phenomenal branch, far more easier to understand, far more easier to apply and remember as compared to the 4 big brothers. So have good luck and enjoy the forthcoming session in orthopedics. Thank you.